Hello, and welcome to another Vegan Primary Care live session. This is Dr. Scott Harrington coming to you live from my doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor from the comfort of your own home from most U.S. states. If you happen to live in Florida, then I am also open for in-person visits Fridays in Pinellas Park, Florida. That's just north of St. Petersburg. Come see me not just as a one-time consultation, but as your primary care doctor, someone who gets to know you and someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, a healthy vegan diet, exercise, and lifestyle changes will always be my first recommendation. My goal is to help you take control of your health, and through the power of a healthy lifestyle, we will work to heal your chronic conditions with the ultimate goal of helping you come off your chronic medications. For my patients who do cut out animal products altogether, you will not only be helping yourself feel better, but you will also do your part to end animal suffering and to decrease your impact on the environment. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we are streaming to multiple platforms, YouTube, Facebook, Twitter, and Twitch, ready to take your questions. Okay, we have several folks on from Facebook and YouTube. All right. Okay, so we've got several folks on. We've got Purity and Plant says, good morning, Dr. Harrington. What could be responsible for high fibrinogen levels? Okay, man, you may have stumped the doctor, but I do know fibrinogen is somewhat of an inflammatory marker. But there may be other medical aspects of it. It's something that you would want to come in, like if you were seeing me or seeing another doctor, you want to come in and you wanted to run through a diagnostic workup. When there's something a little bit off like that, and I have a patient, I review all the stuff about fibrinogen, and then we go through it and we come up with a workup plan. So, yep, that's right off the cuff. I'm not the fibrinogen expert, but I believe that can be a de facto inflammation marker. So there are other ones like CRP and sedimentation rate and just your general white blood count. And if all of those are kind of normal, and so you don't have hideous inflammation going on, there may be a very specific reason why fibrinogen is up. So that's what I would recommend. I would recommend seeing the doctor and going through a workup. Okay, and Purity and Plants adds, my total cholesterol dropped from 166 to 125 after just 3 months on a plant-based diet, but my LDL is higher than my HDL. Is that a problem? Okay. Well, LDL is usually higher than HDL. HDL is 30s, 40s, 50s. LDL, 70s, 80s, 90s, and sometimes, higher. So if your total is down, that is great. That is really great. A total under 150 is ideal. So once your total is that low, you don't have to worry too much about the HDL. And your goal hopefully is to get your LDL down to 70 or less. Other folks will try to look at various particle sizes of LDL and ApoB and various lipids. But I think that kind of makes it kind of complicated. The fact that your total is that low is very good, is very good. And so the cholesterol aspect, I think you can kind of put that to rest as a potential factor for you for heart disease and that sort of thing. So I wish my total cholesterol was 125. I think mine is like 155 or something like that. Okay, thanks, Purity and Plants. Okay, Rich Hutchins says, hello, hi, hey, Rick. Nice to see you, Rick. Okay, we've got folks saying they're going to see me later, so this is very good. That is Melissa. All right, Melissa. And all right, we've got folks on here. in general, leave your specifics about your health in terms of your medical diagnoses and things, kind of generic, leave them kind of generic, so as to not put your medical history on the chat, ideally. Okay. Rena says, is sodium level from Bragg's liquid aminos just as bad as added table salt? The ingredients are only soybeans and water, and the sodium is 310 milligrams per teaspoon. So yes. So sodium is bad, in general. I mean, you get a little bit of sodium from certain high sodium vegetables like celery and stuff like that, but it's I assume it's less than that. You want to be very sparing with additives and dressings that are high salt, things that are loaded with like soy sauce and different things like this. They're high sodium. They're flavor enhancers, and they taste great. But you want to be really sparing with them, because it's easy to bust your 1,500 milligrams of sodium per day. So I do like that you're focused on this and you're checking it out, because until you start to focus on that, it just creeps in and you'll go way higher than you should on accident, just because you're not paying attention. What's that saying about, you can't track anything, you don't have a number, or you can't quantify? So I'm really glad that you are tracking that, because elevated sodium is one of the biggest risk factors for high blood pressure and a variety of other medical problems. And you generally, it can worsen autoimmune illnesses, worsens vascular health. It's a problem with people who have congestive heart failure. They will end up retaining a bunch of fluid. So be careful with this. Sodium is bad for you in general, because we get plenty of sodium from the plant foods that we eat in general. So good idea to take a look at that. Thanks, Rena. Okay, so we've got Vita Liberata. Howdy. Are sublingual vitamin B, B12, and vitamin D better absorbed than pill form or gummies? I think so. I think especially with B12, the B12 might be important to do sublingual. The biggest concern with B12 is absorption. It is a water-soluble vitamin. You should take it on an empty stomach, B12. So if you do it orally, B12, empty stomach, keep it by your toothbrush. You'll get better absorption. Now, vitamin D, I recommend taking this when you've eaten some food that contains some sources of fat. If you have any nuts, if you have any avocado, or if you're eating a food that, contains some amount of oil or something, then that's when you get better absorption of your vitamin D. So vitamin D is with food. Doesn't necessarily, I'm not sure about sublingual vitamin D, but sublingual B12 is a reasonable thing to do. I'm not sure if it's better than oral, but maybe that would get around the fact of having to do it on an empty stomach if you just did it sublingual. I'm assuming that what happens when you do the sublingual B12 is that you end up just swallowing it, and it ends up being oral B12. So unless you are kind of letting it soak in through the sublingual area, my assumption is that it's basically oral B12. All right. Okay. Brittany says, how to take care of eczema with a vegan diet. Okay. Brittany, I'm glad you asked this question. Eczema is awful. It's awful. It's itchy and it's irritating, and it can really change your life. And it usually improves pretty dramatically when you go on when you remove dairy from your diet. But it's not 100%. Sometimes people will still deal with significant eczema. So my story about eczema is that your skin is like, if you imagine a brick wall. Imagine your skin like a brick wall. And the bricks have the mortar in between, the grout in between the bricks. when people have eczema, it's like the grout in between the bricks is missing, and the body feels like there's the insides of the body are exposed, or there's holes in the skin, and so the body inflames the area, and it sends a lot of inflammatory aspects to kind of fill the holes, and so you get irritation, you get like almost like wound like situation on the skin. And so how do you fix the holes in the mortar? You spackle it. You spackle those holes in the mortar with thick grease. So I recommend things like, there's CeraVe brand, and there's Aquaphor, thick ointments, greasy ointments. So in areas that you're getting eczema, you want to be continuously kind of applying a thick ointment that acts to seal those holes in the skin, microscopic sort of holes that your body perceives. And then after about 3 or 4 days, the everything starts to calm down. So what can create those holes in the skin? Again, hot soapy water. One way to really flare up your eczema is to sit in a hot tub or sit in a hot bath, a hot soapy bath, and then not put on thick lotion when you come out of the bath. That is a good sure way to really flare up your eczema. So that is a non-dietary recommendation, but it is problematic because your skin. The vegan and lifestyle way to manage eczema is to avoid dairy, mainly dairy. So I hope that helps, Brittany. There are steroids and stuff that people use when it's really, really inflamed, but you can get away a lot with just using Aquaphor, which is like Vaseline, and you're putting it on the areas that are usually highly inflamed, because you're literally trying to seal it. You're trying to seal the skin, and it helps. Okay. Tamara Sergi says, Mom and I say hi. Hello, Tamara. Good to see you. Okay. Let's see. So if you haven't already, if you like the content here at Vegan Primary Care Live, go ahead and hit like. And if you haven't been over to YouTube, go ahead on over to YouTube and subscribe to my YouTube channel, because once I get over 100 subscribers, I can change the long gobbledygook URL and turn it into Vegan Primary Care. So my goal is 100 subscribers. Okay, Miyoshi Hicks says, Doc, why do you think we aren't hearing much about COVID anymore? Have we acquired herd immunity in your estimation? Okay. Well, I'm not Dr. Fauci. I'm not an infectious disease expert. And so in terms of, I haven't seen the, epidemiological numbers in terms of herd immunity. However, it kind of seems like with each variant, we are, you have a peak and then sort of a decline. And so from this recent Omicron, we're definitely on the decline. But there are new variants that are persistent and are popping up in other areas of the world. And now 30% of our cases are the newest variant. I think it's the BL2 or something like that. And so we can expect increased cases. It's supposed to be even more contagious. And so the problem is, culturally and socially and all this, we've sort of become fatigued with the idea of this pandemic. And so, but it's still with us. It's probably going to be with us. And it's going to be something that we sort of adapt our way of life to. And so, do I think we've reached herd immunity? I don't think we've reached herd immunity. And I think it's kind of like it'll be kind of like the flu in terms of its, how it keeps coming back and keeps mutating and changing. And I think at some point they'll have to update the vaccine to make it more effective for the latest strains. And they're debating about, additional boosters and this kind of thing. So I think it's still important to stay vigilant, especially if you have family members who are immunocompromised. And so, unfortunately right now we're kind of all fatigued with the idea of the pandemic, and it's problematic because it will continue to persist and rage on. Okay. Tamara Sergi says, what's your opinion on Moringa oil? Mom uses it on her skin irritations. It's awesome. Unless you tell us otherwise, then mom will be mad at you. LOL. Well, Moringa is a plant that has a lot of hype about it in terms of, I think, it's reasonable. I've heard that Moringa itself, if you eat the leaves or eat the leaf powder, that it can be kind of, that you don't like the taste, or the taste can be kind of rough. But it does have high nutrient value, but it has a similar nutrient value to other fruit and vegetable. So I haven't heard of Moringa oil, but if you've used it and it is helpful, I haven't heard negative side effects. The only negative thing I hear about Moringa is if you get Moringa powders from various places, they may have sort of contaminant leads and different. You want to try to get it from the best reputable source, and you worry about contaminant for the oral Moringa. Okay, we've got Shirley Narducci says, howdy, Doc. Good to see you. Good to see you too, Shirley. All right. I've got a quote here. And this was one from someone that was on Chef AJ's podcast recently, a guy named Dr. Nathan Bryan. And I thought it was a pretty good point that he brought up. He says that they started talking about supplementation and do you need to supplement this and that and this and that. And he was sort of suggesting the most important thing is to eat a healthy diet initially, because he says, it's easier to supplement what you're missing on a whole food diet than to bounce back from the toxins of a processed diet, no matter how much you supplement. And so I thought this was a very good point. It's a very good point. Some people say, well, you don't get B12 unless you eat meat or this or that. It's way better to eat a whole food plant-based diet and supplement with a little bit of B12 than to be eating these other foods that contain so much baggage and toxins and antibiotics and hormones and that cause other problems with your own gut microbiome. So always the goal is a whole food plant-based diet with no added salt, oil, or sugar. Organic if you can, but if you can't, then eat the regular food, because the pesticides are present but are very, very, very low and are still reasonably safe. So if you can't get organic, don't switch to like a processed food. Just eat the regular produce that was non-organic. All right. Purity Implant says, what do you think about algae-based omega-3 supplements? Okay, this is a hot topic. One, I think that if you take a supplement, you don't want to take the fish oil. You want to get it from the source, from the algae. That's where the fish get it. So if you are taking omega-3 supplement, make sure you get an algae-based supplement. What's the dose? The dose is 250 milligrams, about that, 260, 240. You'll see several of those, but about 250 milligrams. And you want it to contain long chain fatty acids like EPA and DHA. So this dose is the brain dose. Now, there are high doses of omega-3 fatty acids that they have used in the past for high triglycerides and cardiovascular health. And these things have been associated, these medicinal doses have been associated with problems, with blood thinning problems, and with there has been some association with prostate cancer, although I don't know how strong that association is. And so it had kind of scared me away of the idea of recommending omega-3 supplementation. So I stopped taking omega-3 supplements and I switched totally to flax, getting my omega-3s from ground flax. So A tablespoon of ground flax is what I do every day in my oatmeal. And that's where you get your omega-3s. Now they're short chain fatty acids that your body will elongate. And several folks like Dr. Clapper and other sort of the vegan royalty folks that I suggest, or like vegan royalty, had suggested, why take the preformed EPA and DHA when you could take the resources, the short chain ALA, and let your body do how much ever elongation that it wants, and so that it has the perfect amount. And I kind of like this idea. However, there are doctors like Dr. Furman who recommend that people need these preformed long chain fatty acids. And so Dr. Furman does recommend this. You can test your omega-3s with the Quest Diagnostics lab. But the problem is that you wonder a little bit about the how you wonder about the validity of this test. So there's hot debate on this side. What am I doing? I'm still doing the flax, but if I switch, I will add the 250 milligrams, the brain dose of omega-3s, and that is, so I'm not taking the high dose omega-3s, just the sweet spot. That's kind of the next evolution. If I decide to supplement, that's what I'm going to do. Thank you, Purity and Plants. Okay, Karen Hodgins says, does grapefruit only affect statins? Is it okay to take with blood pressure medicines? Okay, grapefruit, there's some sort of enzyme or something that gets activated when you take grapefruit. I'm going to see the list, the interactions with grapefruit. Let's see. I'm pulling this up, and when I'm streaming it, my internet is usually pretty slow. So, but this is a good question. So whenever you take, and this is why I get worried when my patients take several different medications, 4, 5, 10 medications. I get worried because how do you know when there's various interactions? It gets very complicated. And just simple interactions with your food, like kale and different things that will affect warfarin, will affect blood thinners. And grapefruit, it affects statins and various things. Of course, it does. Grapefruit does affect statins. It affects anticoagulants, calcium channel blockers, which are a blood pressure medication, such as amlodipine. It can, and antiplatelet medication. So it can have an effect. So talk with your doctor about this. Meanwhile, avoid additional having grapefruit. Instead, switch to other citrus, which shouldn't have an effect. Grapefruit seems to be the main culprit. So I hope that helps, Karen. And it was a great question. Okay, Shirley Narducci says, Doc, can you talk about magnesium? Is it worth taking? Okay. I find that this is overblown in terms of supplementation. And this is because with a plant-based diet, you tend to get a lot of magnesium. You tend to get plenty of magnesium. A lot of people who talk about this are the, heavy protein folks, CrossFit. There are CrossFit vegans, but a lot of times, CrossFit, high protein, carnivore type diet, those type of folks are not getting a lot of magnesium, and they're seeing it from on high about, how we need to be taking magnesium. And so, but with the plant-based folks, you don't really have to worry too much about this because you're not losing heavy, magnesium, and you're taking plenty of magnesium. And so I don't recommend supplementing it. If you're already taking B12 and vitamin D, just keep adding on more supplements to the stack. You can kind of get yourself where you walk out of GNC with $300 worth of supplements. And so I'm always trying to deflect and avoid if I can get it with my food. And magnesium is a perfect example of something that we get from our food. We get plenty, and so it should not to be of a concern. Now, if you're ever curious, you ever want to know, I love that Chronometer, a free app that you can get, and you can do 1 or 2 days of food logging to get yourself kind of oriented to what your magnesium intake is from your typical diet. Food logging is a pain, and it's hard to keep that up for more than 1 or 2 days of being vigilant about it to kind of get what the brass tacks, the actual truth about what you're eating. It's a good exercise, doing it once a quarter or once every 6 months just to try to get yourself oriented. But yeah, do that. See if you're taking enough magnesium. And if you find that you're taking way under the amount that's the RDA, then simply supplement up to what the RDA is. Okay. All right. Okay, Shirley says, I have a tendency to get Charlie horses. I also have trouble sleeping. Will magnesium help, and how much each day? So it was very common knowledge, or commonly recommended, that if people were getting muscle cramps to take magnesium, and that was the main cause. But when studied, magnesium didn't decrease the muscle cramps. One of the weird sort of things that people used in the past for muscle cramps was quinine, and it actually works to reduce nighttime muscle cramps. But tonic water is loaded with sugar, and it has quinine, and quinine has weird side effects with arrhythmias and the heart and that sort of thing. So we don't really recommend that anymore. So the recommended, if you're dealing with muscle cramps, the recommended thing is, one, making sure that you eat dinner. If you have nighttime muscle cramps, make sure you eat dinner so that you're not in sort of a starvation type state, so that you have electrolytes, plenty of electrolytes through dinner. Do a reasonable amount of stretching right before bed, where you do the calf stretches, lean into your bed with a straight leg and do some calf stretches. And do a little stretching routine. The other one, and this sounds kind of dumb, but this is what is actually recommended in the expert medical literature, is to remove the sheets from the tuck in at the bottom, so that your feet can sort of sit in a natural position, as opposed to like stretch down. And if you happen to get Charlie horses in the middle of the night, then you get up and you walk around, and you walk for a short time until it calms down and that sort of thing. So you can see your doctor and try to get imaging if you have nerves or pinched discs in the back that are causing radiating symptoms down your leg. But if it's simply the muscle cramping, it might not be that. So that is the actual recommendation for muscle cramps at night. Okay. All right. Karen says, thanks. I was about to eat 2 grapefruit and I wanted to eat them. Yeah, so there is an interaction with grapefruit and blood pressure medicines called calcium channel blockers, such as amlodipine. So yes, definitely be careful. Every once in a while, probably okay. But if you have a grapefruit fetish and you're eating it all the time, you may want to avoid that. Anyway, that's about our time today. I want to say thank you for everybody who've come and asked questions. It's been a great time. Once again, stay vegan, stay plant-based, and I will see you back next week. You take care. Bye-bye.